नाही चालू नाही झालं, होईल आता 5 मिनिट.
काय तर ते
We've reached about 25 people, I think. Sir, should we start?
Ame,
Sir.
Waiting for side signal. Na? He is allowing people to enter inside on the Slido platform.
Yeah.
They'll require a second device, so we have to give them time to log in. 5 minutes.
Time to log in.
So I think 34 are already there here, participants.
Yeah.
Out of that, I think we are 6 minus K, almost 27, 28.
Yeah.
Attendees at 28.
Doctor, we can start at 9:10, doctor. We have 2 more minutes.
Yeah, 3 more minutes. I am already forwarding on all the PG groups and all which I know. So they'll join.
Yes, sir.
It's 9:10. Should we start?
Yeah.
Okay, just a minute.
$31.
Okay, we are live now, Doctor. You can start the session.
Very good evening to all my dear opthal friends who have joined today, the postgraduates, the fellows, and the consultants. This is the 7th edition of the quiz that we are going to conduct today, and we have had a very nice response, good number of winners, good prizes to win, and I'm sure this also is going to be very interesting and a little challenging for the postgraduates. We have with us two quiz masters, Dr. Amay Kulkarni and Dr. Jai Bhopi, who are going to conduct today's quiz. There will be around 40 questions. All the details will be explained by Dr. Amay Kulkarni first. He is going to start the show, and then the quiz will be played. So over to you, Amay and Dr. Jai. Best of luck.
Yeah. Thank you, Taswala sir. It's a wonderful initiative that you've taken. Let's get on with the rules. So the rules are very simple. All MOS members and non-members can participate. There are going to be 40 questions. You will get 20 seconds for each question. You can start sending your answer once the timer starts. This is very important. Don't press the answer before the timer starts. Press the correct option followed by the save button to record the response. Only pressing the option is not going to record your response. We are looking for correct response and also the fastest one to give the correct response. There are going to be 4 winners. Only MOS members are eligible for prizes. Non-members, if they win, can join MOS and then claim the prize. For comfortable participation, please use 2 devices. One to view the questions, presentations on Zoom. The other device to provide your answers. Now, the last line is the most important. Quiz master decision is going to be fine. Thank you. Over to Dr. Bhopi, sir. Could you please start with the quiz?
Yeah. Should we start with the first question?
Yes, very much.
Yes, sir.
So the first question is, mutton fat keratic precipitates are not seen in uveal. First is A is uveal effusion syndrome, B tuberculosis, C sarcoidosis, D fungal infection.
Your time has already started. Five seconds left. Time is up, sir. You can.
Can I show the answer?
Sir, you can go to the next slide. Yeah.
The answer is A, uveal effusion syndrome. So this is the second question. The following report is associated with increased mortality in an enucleated eye with retinoblastoma. A is involvement of optic nerve. B is presence of calcification within the tumor. C is necrosis within the tumor. And D, presence of retinal detachment.
Five seconds left. Okay. Done, sir. You can go to the show us the answers.
The answer is A.
Yeah.
Shall we go to the third
Involvement of
question?
the optic nerve.
Involvement of the optic nerve.
Yes, sir.
So the third question is Schwalbe's line represents A is junction of the choroid and retina, B termination of Descemet's membrane of the cornea, C is junction of bulbar and palpebral conjunctiva, and D is the anterior limit of the Bowman's membrane.
Okay. Time is up. Yeah.
The
Sir,
answer
you
is
can go to the
B.
answer.
Answer is B.
So it's the termination of Descemet's membrane of the cornea. Okay.
Yeah. The fourth question is visual field abnormalities in the Jerem's area are seen in A cataract, B glaucoma, C keratitis, D proptosis.
Time is up.
Okay. Time is up.
The answer is B glaucoma. So the fifth question is person is not able to look down. Which intraocular muscle is affected? A is superior oblique, B is inferior oblique, C is superior rectus, D lateral rectus.
Five seconds to go. And the time is up.
The answer is A superior oblique. Then the sixth question is primary action of the superior oblique is A intorsion, B depression, C adduction, D abduction.
Four seconds to go. And the time is up.
Answer is A intorsion. The next question, weakness of both adduction and abduction is seen in A is Duane's retraction syndrome type 1, B Duane's retraction syndrome type 2, C Duane's retraction syndrome type 3, and D is all.
12 seconds to go. Easy question. Everybody should attempt. And the time is up.
The answer is C, Duane's retraction syndrome type 3. The next question, oculomotor nerve palsy affects all the following muscle except A is superior rectus, B lateral rectus, C inferior rectus, D levator palpebrae superioris.
The easiest of the questions. Everybody should answer. 9 seconds to go. 6 seconds. And your time is up.
Answer is B, lateral rectus. The next question, name the location of the nucleus of the nerve supplying the medial rectus muscle. A is facial nucleus, B is Edinger-Westphal nucleus, C is superior colliculus, and D olivary nucleus.
And your time is up.
C
Time is up.
superior. Answer is C superior colliculus. The next question. All of the following are involved in the pathogenesis of diabetic macular edema except A is retinal pigment epithelium dysfunction, B is oxidative stress, C increase in VEGF, and D is increase in protein C kinase.
Diabetic macular edema is a very common condition. All the freshers and the postgraduates should know. 7 seconds to go. And the time is up.
Answer is D. Amaya, you can start now. 11th.
Yeah. Sir, you will have to shift the slides. So let's get to the 11th question here. A 20-year-old presents with a history of tennis ball injury to the right eye. On examination, a red spot is seen on the macula. The most likely diagnosis is A. Macular hole, B. Berlin's edema, C. Macular tear, or D. Macular hemorrhage.
And your time is up.
Yeah, so the answer is pretty straightforward. It's B. Berlin's edema.
74% has
question,
given
sir.
the right answer. Amay, very good. Yeah.
Yeah.
Go ahead, sorry.
Yeah. Great work. So we now question 12 is what is Lee's disease? Is it periphlebitis retinae? Is it intraretinal cyst? Or C, is it posterior vitreous detachment? Or is it exudative retinal detachment? Again, a very straightforward question.
Yields we always see in the younger generation. And so it is quite easy. The quiz masters have set very easy questions for you. 2 seconds to go. And your time is up. 91% has given the right
I think
answer.
100% of them should be able to answer it. Yes. Yes. Fantastic. The answer is A. We go to the next question. Now, this is, please tell me the average corneal endothelial cell count. Is it 2000 cells per mm square, 1800, 3500, or 2800? This is the average corneal endothelial cell count. Slightly tricky, but you should be able to answer.
Everybody must be aware of the pachymeter readings and also the endothelial specular microscope. So the time is up.
So here the answer is D, it is 2800. Let's go to the 14th question. What is the approximate number of retinal?
I think his voice is gone.
Approximate number of retinal photoreceptors is A is 1 million, B is 25 million, C 10 million, D 125 million.
Am I not audible?
In between your voice had gone, so Jai has taken over.
Yeah. Okay, sir.
Yeah. 7 seconds to go, 5 seconds to go. Not a difficult question. And the time is up.
It's D 125 million.
The answer is B.
So here is the
Let's
next.
go to the next question, sir. Contrast sensitivity is affected in A, diabetic retinopathy, B, optic neuritis, C, myopia, or D, astigmatism.
Very, very easy question set by the quiz masters. Just 10 seconds to go. Diabetic retinopathy, optic neuritis, myopia, and astigmatism. 4 seconds to go. And your time is up.
Yeah, so the answer here is B, it is optic neuritis.
79% have given the right.
Sir.
Yeah. Ramay, sorry to interrupt. Are you seeing the Slido
Yes,
this thing also side by side? Okay, fine.
This is the 16th question.
Hello?
Yeah, we can hear you. Amay, go ahead.
Yeah, which does not hold true for central serous choroidopathy. A, smokestack appearance of FFA. B, ink blot appearance on FFA. C, flower petal appearance on FFA. And D, vision correctable by convex lenses. So which does not hold true?
CSR, everybody sees nowadays. And we are very well aware of different appearances on FFA. Just 5 seconds to go. Come on. And the time is up.
Yeah, so the answer is C, does not show flower petal appearance. Yeah, let's go to the next question, sir. Question number 17.
Yeah.
Which of these is a photo disruptive laser? Very, very simple question. A, ND-arc laser, B, frequency doubled ND-arc laser, or C, diode laser, or D, argon laser. Which of these is a photo disruptive laser?
Just 5 seconds to go. Everybody has laser. Should be aware. And the time is up.
So the answer is A, ND-arc laser. Let's go to the next question, sir.
Yeah.
Which of these anti-glaucoma drugs are contraindicated in patients with sulfa allergy? So is it A, bimatoprost, B, brinzolamide, C, timolol maleate, or D, travoprost?
Regularly use anti-glaucoma agents. Everybody should be aware. And your time is up.
Yeah. So the answer here is B, brinzolamide. Let's go to the next question, sir.
Yes.
Yeah. So while doing retinoscopy, red reflex moves in opposite direction to the mirror in hypermetropia, myopia greater than 1 diopter, myopia of 1 diopter, or myopia lesser than 1 diopter. Appears to be very simple, but you'll have to be careful.
Refraction every day we do in and out all the patients. Manual refraction, of course. Nowadays, auto ref has come, so a little less of it, but nevertheless, you should know. Bread and butter. And your time is up.
Yeah, obviously. So the answer is B, myopia greater than 1 diopter. Let's go to the next question, sir.
Yes.
So, image formed by a prism is it virtual, erect, displaced towards the apex, or B, is it inverted, real, displaced towards apex, or C, virtual, inverted, displaced towards apex, or is it real, erect, displaced towards apex?
Prisms we regularly use,
Very basic.
especially in spin
Yeah.
cases. So you should be able to tell this correctly. Just a second to go and your time is up.
So the answer here is A. It is virtual, erect, displaced towards its apex.
Very nice.
Dr. Bhopi, sir, could you please take over?
Yes, sir.
Yeah. Jay,
Yes,
just a
sir.
request. If you also have the Slido score, tell them that 70% is given correct, 20% is given correct. You are in the right this thing, sample answer, and then go for the next question. So people
Sir,
are aware how
Sir,
many
I
are
could,
there.
I could not see those numbers, sir.
Achha, you're not logged in two devices. Okay, I'll tell you.
Sir, I am logged into the device. I'll tell them the numbers.
Yeah, that'll be nice.
So the next question is, what is the clinical diagnosis seen in this picture? Whether it's A, choroidal melanoma, B, retinoblastoma, C, hemangioma, and D, benign nevus.
Yeah, so the time is up.
Answer is A, choroidal melanoma.
76% have given us the right answer. That's
Great
wonderful.
going. Yes.
Next question. What pattern seen in topography in this picture? A, symmetric bow tie appearance, asymmetric bow tie appearance, claw pattern, inverted bell sign.
Different patterns you see on topography. It doesn't look to be difficult. Just 3 seconds to go. And the time is up.
Time is up.
The answer is B, inverted bow tie appearance. Asymmetric bow tie appearance, B.
Yeah, so 76% have answered correctly.
So next question is, what is the clinical diagnosis seen in this picture? A, rhegmatogenous retinal detachment, B, choroidal detachment, C, proliferative vitreoretinopathy, D, Eales disease.
Yeah, so the time is up.
Answer is A, rhegmatogenous retinal detachment.
So 59% of them have given the right answer.
So next question, what is the diagnosis seen in this picture? A, granular dystrophy, B, Fuchs endothelial corneal dystrophy, C, Lesch corneal dystrophy, or epithelial basement membrane dystrophy.
The time is up, sir.
So A, granular dystrophy.
79% have given the right answer. Very good.
So next question is, what is the clinical diagnosis you see in this picture? A is Stuttgart's macular dystrophy, B, central serous chorioretinopathy, C, age-related macular degeneration, and D, choroidal neovascular membrane.
Time running out. Very simple diagnosis. Not difficult to answer. 3 seconds to go. And your time is up.
Answer is B, central serous choroidopathy.
77% have answered that, sir.
Very good.
So next question, what is the clinical diagnosis you see in this picture? A, dry ARMD, B, wet ARMD, C, cystoid macular edema, D, macular dystrophy.
It's a common thing that we keep seeing in the OPD. So try and answer it. 3 seconds to go and your time is up.
Answer is A, dry ARMD.
Yeah. So I think 35% gave the answer.
A little difficult.
So next question, what is the clinical diagnosis seen in this picture? A, non-proliferative diabetic retinopathy, B, proliferative diabetic retinopathy, C, clinically significant macular edema, D, gyrate atrophy.
Day in and out, we see a lot of this. So should not be difficult. The grade of difficulty has increased. I do agree, but all are smart people who have joined today, and I'm sure they're going to answer it. Just 2 seconds to go and your time is up.
Answer is B, proliferative diabetic retinopathy.
I rightly said that. Good.
Yeah, so 91% people have answered that. Very well done.
So
Great going.
Next question is 42-year-old male patient with a history of road accident was admitted for chest trauma. Vision in both eyes is counting fingers half meter. Looking at this picture, what is the likely diagnosis? A, central retinal vein occlusion both eyes, central retinal artery occlusion both eyes, Usher retinopathy, traumatic optic neuropathy.
Yes, 5 seconds to go. Trauma we see very regularly. RTS are regularly seen. Your time is up.
Answer is C, Usher retinopathy.
Participants are becoming smarter. 97 people have got it correct.
97.
So the next question is, name the syndrome seen in this picture. A, Cohen syndrome, B, Usher syndrome, C, Goldenhar syndrome, and D, Bardet-Biedl syndrome.
Very, very commonly seen this. Everybody right from the postgraduate to consultants must have seen it. Very interesting situation. The diagram itself is so depictive. So do answer, just 2 seconds to go and your time is up.
Answer is C, Goldenhar syndrome.
100%. Score is increasing, huh, Jay?
Yeah, yes, sir. Yes, sir.
Bolo. Next.
Next question, a 20-year-old male patient with history, a complaint of sudden drop in vision in his right eye after being hit by a tennis ball. What is your likely diagnosis? A, central retinal artery occlusion, B, Berlin's edema, C, choroidal rupture, D, resolving vitreous hemorrhage.
Tennis ball injury is very, very common and frequently seen. So it should not be a difficult diagnosis. 4 seconds to go. Need to answer. People are getting smarter and your time is up.
So answer is B, Berlin's edema.
Great going. Yeah, next. I think Amay has to take over.
Amay has to take over.
Yeah. So let's look at the picture very nicely and please tell me what is the clinical diagnosis here. Is it papilledema? Is it optic disc drusen? Is it diabetic papillopathy? Or is it non-arthritic anti-ischemic optic neuropathy?
You can zoom it on your this thing if you have a smartphone. You can see that picture, zoom it and see and then answer. Just 4 seconds to go. And your time is up.
Yeah. So the answer is B. There's an optic disc drusen. 93% of you have gotten plotted. Fantastic. Let's go ahead with the next slide. So here is a picture of the disc. Please tell me which finding is not seen in this picture. Nasal shifting of blood vessels, bayoneting sign, lamellar dot sign, and superior notching. Which is not seen in this picture?
Glaucoma, everybody is well versed. This is the optic disc classical picture. To try and answer it, just 5 seconds to go. We're getting good scores now, almost crossing 90%, and your time is up.
Yeah, so the answer is D. So there was no superior notching there. Very good. We'll go to the 84% of people have got this. So let's go to the next slide. A 34-year-old male presented with history of injury to his right eye with a shuttlecock. Which glaucoma is likely to happen here? Is it angle recession glaucoma? Is it pseudo-exfoliative glaucoma? Is it chronic simple glaucoma? Is it acute congestive glaucoma? These are very nice
So,
pictures that accompany.
yes, very nice pictures, very easy to answer. So don't miss this chance. We are nearing completion of this quiz, very close to it. Score maximum marks, 4 seconds to go. And the time is up. And 100% have given right answer. Kya baat hai?
Right answer. Yes. Angle recession glaucoma. Let's go to the next slide, sir.
Yeah.
Yeah. So you can see the picture here. So this obviously is headlight in the fog. Where is it seen? Is it seen in Eales disease? Is it seen in ocular toxoplasmosis, cytomegalovirus retinitis, or bacterial endophthalmitis?
Commonly discussed in the webinars, in the retinal symposiums and all. It's not difficult to answer. 5 seconds to go. We have 34 questions now put up and your time is up.
Yeah. So this is ocular toxoplasmosis. Answer B. 91% of you have gotten it right. Let's go to the next question, sir. So please identify what this is. Is it anterior lenticonus? Is it pseudo exfoliation? Is it vitreous opacity or traumatic cataract?
Again, the picture is quite depictive. If you see closely, zoom in, you'll get the answer right away. 9 seconds to go. 35th question has been asked. 5 more questions to go. 3 seconds to go now. And your time is up. 100%
We
have
have
given the
another
right.
100%. Fantastic. Yeah. So the answer is B. Pseudo exfoliation. Let's go to the next question, sir. Yeah. In which condition it is commonly seen? So you first have to identify what you're seeing on the picture and then give us a diagnosis. Is it post-venous and arterial occlusion, post-intravitreal Avastin injection, post-retinal detachment, or is it post-optic neuritis? Please zoom in properly, see what it is, and then answer.
Very commonly seen condition. Should not miss the diagnosis. 5 seconds to go. 36 questions already asked. 4 more to go. And your time is up.
Yeah, so the answer is A. This This is
94%
basically
have
the
given right.
intrusive types. Yeah, so 94% are correct. The answer is A. Let's go to the next question, sir. So what test is done to check blood leak? The very basic question. Everybody has to know this. Is it Shermer's test, Sidley's test, Rose Bengal test, or none of the above?
Day in and out, we see the glaucoma plebs in your OPD, and to find out the leakage, the simplest of the tests is done. So this is a real walkover, and your time is up. 100%.
Fantastic. 100% have given the right answer. So it's Sidley's test. Answer is B. Let's go to the next question, sir. Yeah, so please identify the syndrome. Is it Ehlers-Danlos syndrome? Is it iridocorneal endothelial syndrome? Is it Weber syndrome, or is it Benedict syndrome?
Today is the day for syndromes. So many questions they've asked on syndromes, and they are common. That is why he has asked you. 10 seconds to go. Just 2 more questions to go. So Baka, please, everybody, try and answer it correct. And your time is up.
So the answer is B, and 94% of them have gotten the right answer. Fantastic. Let's go to the next question, please. So please tell me, what is the clinical diagnosis here? Is it megalocornea? Is it retinopathy of prematurity? Is it congenital glaucoma? Is it lower lid ectropion?
Zoom on the picture, very well evident. You can't miss it. There's the final question to come up. This is the 39th question, 5 seconds to go. And there you are. The time is up.
Yeah, so the answer is C. We had asked you what the diagnosis was, and the diagnosis is congenital glaucoma, not the finding.
So
Let's go to the
now
last
the
question.
final question coming up for you. Yes.
So please identify the field defect. Very, very simple. Is it a central scotoma? Is it a paracentral scotoma? Is it hemianopia, or is this an altitudinal field defect?
Fields is one of the basics tests that we do for glaucoma, and there's different. So you should know which types of field is this. And your time is up. And the answer
Let's
is?
give them the answer, sir. The answer is D. It's an altitudinal field defect, and 76% of you have answered that correctly. So with that, we come to the end. Sir, I hope we got good questions here. They were not very difficult. People
It was a mix and match, very well conducted by Amay and Jai Bhopi. You have given the easiest of the questions also, and a slightly difficult and a more difficult ones. I'm sure the people there out, the participants must have thoroughly enjoyed this. As we get this course within a few minutes, I would like to have the feedback from our quiz masters also. What do you feel? How's the quiz gone on with you people? Both of you can have your comments, and then we'll have the participants coming up on the Zoom. We'll be asking them too.
So this is the first time happening, I think, in the MOS.
Yes, monthly quiz, we are holding it, and the finals,
Yeah.
the winners of all this will be eligible for the finals. So that is one more point which I'd like to tell. They should not lose hopes. Those who are there will definitely have a chance to win the final, which have bigger prize money. So Sai, are we ready with the results?
Yeah, shall I publish, Doctor?
Yeah.
You can see it on your mobile.
Yeah, I can see it. So we have Shazia. Can you get them on the panelist? Shazia has won 38 out of 40, and the time is 2.38. So faster finger fast. So that is why she is first. Sudan scored 769, 38 out of 40. Again 4.32. So a little late, but equal number of marks. So as we had declared during the rules, you have to do both. That is faster finger also and the correct answer. Then we have Manik Sardana, 37 out of 40. They are correct, and 2.30 seconds they have taken to answer on an average. And the fourth one is Dr. Basit Ali Lakhani, 37 out of 40. Again, a little delayed, 4.11. And we have Arti Baban Rao, the fifth, with 36 out of 40. And the time taken is 4.54. So can we upgrade them onto the panelists from the attendees?
Already done, doctor.
Talk to them. Yeah. Can you spotlight on the first prize winner? I am on the mobile. So just raise your hand. Who stood first? Dr. Sajia.
Yes, sir.
Yeah. Can you put your video on and give us how was the quiz conducted? Did you like it? Was it very difficult? And introduce yourself totally. Where are you from? Within Maharashtra, outside Maharashtra, and what are you doing?
I'm from
Are you
Chennai,
from
sir.
Chennai.
Yes,
So, hearty congratulations, first of all, for winning
you,
the
sir.
7th round of quiz with a good number. So, you
Thank you,
just
sir.
missed out on 2. Which were the 2 difficult ones?
Sir, by fastest finger, by mistake CSR, I clicked something else, sir.
Okay, okay.
That was
And
a silly mistake, sir.
I know it was the easiest of the questions. So, this
Yes,
is what
sir.
happened. So, that is why we have kept fastest finger first. So, you need to concentrate and focus well. Even if you
Yes.
know the answer and you miss it out, you lose it. But anyway, great going. Are you a postgraduate or are you a consultant? Which college are
Recently,
you
I
at?
finished my post-graduation, sir.
Okay, where are you from? Which
From
college?
Regional Institute of Ophthalmology.
Okay, Chennai.
Chennai. Sir.
So that's good. Very smart. I think South people are winning it, either from AIMS or we have from people coming from South. So Shajia,
Yes,
welcome to the fold of the winners, and you will be definitely be eligible for the finals also. Only thing, if you are not an MOS member, to claim the prize, you have to become an MOS member. So if you
Okay.
share your cell number and all, you must have already done it while registering.
Yes,
We'll be
sir.
sending you details. Do become an MOS member and claim the prize. We won't disclose the prize money now. You will get a
Okay.
surprise, pleasant surprise. So that
Yes.
is one. Who are these second prize winner? Can we have him on the board? Mr. Sudan? Are you there? I just saw, yes.
Sir.
Yes, Dr. Sudan.
Yes,
Yes,
I'm
please.
from.
Yeah.
Yes, I'm from Tamil Nadu, sir. Trichy, sir.
You are from Trichy. And are
Yes,
you
sir.
a consultant, postgraduate, fellow? When have you
Sir,
passed out? Did you enjoy the
sir.
quiz?
Yes, I enjoyed the quiz, sir. Just now I graduated from Punjab Medical College, sir.
Okay. So freshers have got good this thing on the academics. That's very nice. Fantastic. So
Thank you, sir.
welcome to the board of the winners. You're the second winner. You can claim the prize on becoming an MOS member. We have your cell numbers. I think Sai must have already had it. So
Okay,
we'll be sending you all the details. Do become an MOS member. Become
Okay,
a
sir. Thank
fold of the Maharashtra Ophthalmological Society. We are one of the largest societies. We are doing a lot of work. There are prize monies for snippets. Then we are doing a lot of fellowship programs also in future. So you'll be part of that. So congratulations.
Thank you, sir.
Yeah. Who is the third? Manik Sardana. Is he upgraded to the panelist? Manik Sardana?
Yes, he's not
Aye.
joined.
Achha, but he has already, he left or what? Yeah, there he is. I can see. Manik, can you put the mic on and your video on?
Yes, good evening, sir.
A very good evening. Just introduce yourself, which area, whether you are consultant, passed out, or what is it? Your
I
status.
am currently, sir, working as a senior resident in PGI Chandigarh. I did my
Wow,
MS from here only. Yes, sir.
fantastic. So you enjoyed this quiz? Was it very difficult?
No, sir, it was of moderate. Some questions were easy, some were difficult.
Yeah, that is how we do the mix and match. And our
Yes,
quiz
sir.
masters have taken all the efforts to see okay, people score maximum marks. And you
Yes,
are
sir.
the proud winner of this. I am sure would like to become an MOS member to claim the prize. So
Definitely, sir.
sending you all the details, Dr. Rajesh Joshi, our secretary, honorary secretary, will be sending you details for becoming an MOS member. It's a one-click, very easy to do it. You open up, you land up on the page of membership, and you fill up all the details, and there you are.
Okay.
Voila, you become an MOS member. So no downloading the forms, not getting any double proposer and seconder. Very easy, we have made it. So I am sure you're going to be part of it and will be able to claim the prize once you become an MOS member. Thanks
Sure,
for winning once again, Manik. Now
Yes,
we
sir.
have Dr. Bastiala Lakhani.
Hello, sir. Good evening.
Yeah, please introduce yourself, sir.
Sir, I belong to from Gujarat. I did my post graduation from Arvind Pondicherry. Am I audible?
Yeah, a little louder, please.
Yeah, I belong from Gujarat, sir, and I did my post graduation from Arvind Pondicherry. Right now, I am doing my fellowship in Shroff Charity in New Delhi.
Wow, that's great. Hearty congratulations
Thank you,
for
sir.
participating and being one of the winners in this. The 4th place you have got. So
Thank you, sir.
welcome to the fold of MOS. Once you become an MOS member, you'll definitely be able to claim the prize. Good, pleasant surprises. We have got different prizes. The person concerned of Microvision will be contacting you. First, Dr. Rajesh Joshi will send you all the details for becoming an MOS member. So thanks a lot, all of you who have joined. I think in case the person doesn't wish to become an MOS member, the next in the ladder gets the prize. So thanks a lot, each and every participant, for being part of this grand show. The quiz masters, Dr. Amay Kulkarni and Dr. Jai Bhopi, have taken real good efforts. Our backbone, Dr. Sai, who is always there on having a proper platform, so people enjoy it, and it was seamless. And of course, Dr. Rajesh Joshi. So thank you very much, all of you, for joining.
Yeah,
And
thank you
see
so
you
much.
at the next quiz. Those who have won the prizes are eligible for the final this thing. So don't miss it out on the finals. Be part of it, become an MOS member as early as possible to claim the prize. Thank you very much.
Thank you.
Thank you, sir. Thank you.
sir.
Thank you, Jay. Thank you,
छान
Amay.
झालं ना व्यवस्थित
All, thank you
शॉर्ट
to
अँड
all.
स्वीट बघा
Congratulations to
फीडबॅक
all
पण आपल्याला
winners.
चांगला मिळाला वी गॉट अ व्हेरी गुड फीडबॅक ऑल्सो
Yeah.
साई ऑल वेल ना एव्हरीथिंग सम पीपल हॅड टू लीव और एव्हरीबडी केम इन fact I was seeing the numbers increasing as the quiz was going on from 35
Yeah.
40 45 50 52 that is how it was going so
Making
people
Yeah,
did
yeah.
join I
Yes,
had
yes.
put up in almost about 60 groups in that